Hi, I'm Linda Dee from the Fair Pricing Coalition, and we're here to tell you about what's new in HIV and HCV access programs. We do this every year, and we're here at CROI, which is in Boston this year. That's a conference on opportunistic infections and retroviruses. And I have with me Jeff Barry, David Evans, and Murray Penner. We're going to talk about what we always do, what our new initiatives are, and some of the complications that are involved with these different programs that will allow people to access HIV and HCV drugs. So first, Jeff, would you like to tell us about just generally what the FPC does and where people can find out information on these particular access programs?
Sure. Thanks, Linda. The FPC, Fair Pricing Coalition, was founded by the late Martin Delaney, Project Inform. And what we do is we work with pharmaceutical companies, and we meet with them and to talk about pricing and to negotiate pricing for the HIV drugs and hepatitis C drugs that they manufacture. As you know, these are very expensive drugs, and so negotiations are really critical to trying to keep the costs low. What we found as part of those discussions, access to the drugs is a key issue, not only in terms of price, but in terms of copays and people who actually just don't even have insurance. And so we have worked really hard to create patient assistance programs and copay programs that help cover the costs for individuals who cannot otherwise afford these drugs, these life-saving drugs. Some of the copay programs, what they do is you'll have either a card that you take to your pharmacist, you'll pick it up either at an AIDS service organization, your doctor's office, your pharmacist, or sometimes you can get them online. And you register, and then you take it to when you fill your prescription, and it'll cover your copay costs. Sometimes these copays can be upwards of $400 for each drug, and when you're taking multiple drugs, the cost can add up really quickly. Patient assistance programs are designed for people without insurance and who have no other options. They're not covered under ADAP or Medicaid, Medicare, and so based on a percentage of their income, if they meet the qualifications, sometimes it's 400 or 500% of the federal poverty level, and they will be eligible for a free drug through these patient assistance programs from the companies.
So, and we have a website that has all the information for all the companies for HIV and HCV drugs. First, for the patient assistance programs that talks about contact information and eligibility criteria for all HIV and HCV drugs. And again, that's for people with no insurance. And the copay programs are for people with insurance but that cannot afford the out-of-pocket costs that go with that. So a good segue into that is these out-of-pocket costs. And we know that we are going to be entering a new age of Obamacare, the Affordable Care Act. And this is going to be great because a lot of people who have never had insurance are going to have insurance. And people with below 250% of the poverty level are going to get government subsidies that are going to help them to afford health care, insurance, and prescription costs. But I think we're learning that it's not going to be fabulous. You know, I mean, if you have a bronze plan, your out-of-pocket maximum costs will be as much as $6,350 a year. So that's a lot of money. So because of that, we've been trying to do something new with the companies, trying to make them cover not only a copay cost, you know, that's sometimes $20, sometimes $400, as Jeff explained, but also the coinsurance costs, the deductible costs that are going to go along with the new Obamacare rules. So some companies have agreed, most companies have agreed to participate in these new copay programs. I think we have every drug company in HIV except Merck, which unfortunately manufactures Icentris, one of the very important integrase inhibitors. And also, we haven't heard yet. We're expecting promising news from ViiV, who manufactures the new dolutegravir, which is a once-a-day integrase inhibitor that's very promising. So, other than those two companies, all of the other HIV and HCV drug companies are going to participate in a program that covers not only the copay costs, but also that $6,305 that will be either deductibles or coinsurance, whatever it is. They're going to help patients, access or get the drugs to get the money to be able to access these drugs or get the assistance from each company. So all that information will also be on our website. Now, there have been a couple of complications, as you can imagine, and I think Murray's going to talk to us about why not all the companies are on board and why we're still waiting for news from ViiV in this regard.
Thanks, Lynda. Well, just like much of the Affordable Care Act, there are things that are being implemented that we didn't necessarily know. There are rules still being promulgated. There are still things to figure out. And one of the things that is confusing is that the Secretary of Health and Human Services issued a letter saying that these copay programs could interact with plans that are purchased through the marketplace in the Affordable Care Act. Meanwhile, the Centers for Medicaid and Medicare Services issued a question and answer document that had contradicting information and said that it didn't apply to third-party payers like a copay insurance program, so they couldn't interact with these plans. And so there's been some conflicting information out there. I think that, the advocacy community has gone on record saying we really need this to continue because it's a very important part of access, people being able to access their drugs. Meanwhile, the companies have mostly all sided with the Secretary's determination that they could go ahead and do this, but it's why Merck has chosen in this particular instance not to participate. And we're hoping that if there is some kind of clarification, that it will come down on the side of these are able to interact with these qualified health plans, because this out-of-pocket expenditures, $6,350 for an individual, and that's each individual in a family too. It's not there isn't a family rate for that. That is a lot of money for people to have to put out of their pockets in order to get their medicines, and we're worried that will create further barriers to accessing care. So we really need that to happen. And if any of you have any options of weighing in with your members of Congress or the Secretary or anything, it would be great to continue to push the fact that we need that ruling to come down on the side of being able to participate, or companies being able to participate in the qualified health plan marketplaces.
I think we've done a lot of advocacy with a number of companies that were on the fence, that decided to go our way, that is to follow the Secretary's decision after being pushed into that. A number of companies even changed their minds and said, okay, well, we will follow the Secretary's ruling. I mean, if you can't follow the Secretary of HHS's letter on something, but companies are always afraid of, well, is the government going to sue me, and where is this going to leave our bottom line? So I think that there is something that Murray talked about as far as getting in touch with your Congress people on this. Something that's really scary is that, it's very complicated, these copay programs. I mean, in Medicare, you're not allowed to have these programs because, they don't want people to be induced because they won't have to pay a big copay, but then their insurance payer will have to pay 3 times as much for a brand name drug versus a generic drug, which is a lot less. But in our case, with 95% of HIV drugs and 100% of HCV drugs, we're on we don't have generic equivalent drugs, so we just have the brand names. For instance, Massachusetts has made an exception to this where, people can have access to copay assistance for brand name drugs. So if anybody's interested in working on this or wants more information about how to advocate with your senator or congressperson on this, it would be very helpful, because there are some Republican bills to say, okay, too bad for the Secretary. We want the government to rule like CMS's question and answer document reads, that we want to just rule out these programs across the board, whether it's for brand names or generic drugs. And that would be devastating to people in our communities that would all of a sudden every year have to come up with $6,350, before they get an aspirin. So,
Another couple of things that are related to access that I think are really important include, first of all, in terms of these marketplaces, in California, my organization, Project Inform, did an analysis of what they call formularies, which is the list of drugs that a particular company will cover. And we went to all 11 of the marketplace plans and did an analysis of what they were covering. And frighteningly, some of the HIV drugs weren't even on the lists. And in many cases, none of the hepatitis C drugs were there, especially not the newer ones. So that's a great concern, and something that in your own state you may want to take on as an advocacy issue. And if you'd like help with that, you can go to www.healthreform.org. It's a great centralized resource for people working on those issues. The other thing that we're also finding in terms of access is where these drugs are tiered. Generics are usually the lowest tier, tier 1, where you have the least amount of cost sharing. But tier 5, which is specialty pharmacy, you have to pay a coinsurance, sometimes as much as 50% of the cost of the drug until you've maxed out for the year. So what we're also finding is that many HIV drugs and hepatitis C drugs are at that highest tier. So that's of great concern to us, and we'll need advocacy to help change those policies. And then lastly, as Jeff mentioned, these drugs are not cheap, and especially the hepatitis C drugs, the most recent two especially so, and they bring tremendous advantages. They're oral pills, they're not injections, their side effects are much less, they're once or twice a day. Makes it much easier for the person living with hepatitis C, and not only that, they have much higher cure rates. So they do represent a tremendous advantage to people living with hepatitis C who are looking to cure themselves of the disease. But their high costs are already starting to have a consequence, and that is that state Medicaids for people who are on Medicaid, especially those who are newly eligible for Medicaid because of the Affordable Care Act, may not get easy access to these drugs because the Medicaids are starting to tell us that if they add them, they'll go broke. So the other thing that I think would be really helpful is to advocate around pricing to see if we can start bringing the price of these things down.
yeah, I mean, that's how we started, about pricing and about price increases. And, you know, I really believe that, you know, the drug that David is talking about from Gilead, Sovaldi, is $84,000 for 12 weeks of treatment. It's $1,000 a pill. And I think that if we hadn't beat up on Gilead, it would be $90,000, you know? So that might be the difference between $1 million and $2 million for somebody that can't afford it. But nevertheless, I mean, every little bit counts. So we're in there and we're trying to devise ways to work around the new Obamacare rules and just the new guidelines on what people are going to have to pay. But we'll see you back here next year, hopefully with some better news.
Linda, can I add just one more
Sure.
thing? I just wanted to let people know that the information is available on these programs at fairpricingcoalition.org, and also check out our Facebook page, Fair Pricing Coalition. Also, positivelyaWare.com/copay has a list of all the drugs for HIV, HCV, and then some other drugs that are used for commonly in people with HIV that are non-HIV drugs. It gives details on all the programs and where you can find out more information about them.
Thank you.